this video we're going to be talking about how you can support breastfeeding families as a health professional. Keep watching if you would like more information about how to help breastfeeding mothers really optimise their latch and minimise problems. If you'd like more content like this from myself or other specialists that work with Babyem, don't forget to click subscribe and click the little bell to get notifications when more videos are added. My name's Shel Banks and I'm an IBCLC infant feeding specialist, so I'm a lactation consultant and I work in an NHS hospital and in private practice, and over the last 20 years I've supported thousands and thousands of families with breastfeeding and with getting rid of problems, sore nipples, engorgement and things like that, and really achieving that optimal feeding. The number one thing when supporting a breastfeeding family is about optimising the latch, getting a really wide asymmetric latch, so top lip just over the nipple, bottom lip far from the nipple, wide open mouth, a tipped back head, chin firmly indenting the breast so that the baby can compress the breast and really transfer milk effectively. The second thing is how we achieve that latch, so how we would hold and position the baby in order to achieve that latch. So what commonly works really well is this cross cradle hold, so that the baby is held across the mother's body using her opposite hand to the breast that she's going to be feeding from. Ideally, then mother would place the baby nose to nipple and work out the positioning of the chin from there. So the baby would go nose to nipple and the chin would then bed down onto the breast. That's absolutely key. Having the chin bed down on the breast means the baby gets a cue to open its mouth up really wide so that the top lip comes over the nipple just there and the baby can attach with that wide open mouth. That's really important because the wide open mouth is what leads to the baby being able to transfer milk really effectively, use their tongue and their jaw to compress the breast rather than sucking and pulling on the nipple and causing damage. That's the sort of thing that would lead to cracked nipples. It might lead to soreness at the base of the nipple. It might lead to blockages in the ducts further back. And having that wide open mouth, that tip back head, that really asymmetric latch means the baby is going to feed as effectively as possible, gain weight as effectively as possible, and transfer milk in a small period of time and be contented after they've fed. So once the baby's on and feeding with that wide open mouth, sometimes parents say that they struggle to get the baby to maintain the latch, and actually they kind of slip back into a shallower latch, closing the mouth and tipping the head forward. So the way to get around that is to get a really good hold round the back of the neck and shoulders, and where the baby is attached at the breast and feeding well, actually to press in slightly with the wrist and pull back very slightly towards the baby's feet, so that the baby in essence has its head tipped back slightly further and is really well anchored onto the breast. That will help the baby to continue to use the tongue and the jaw to really pull the milk from the breast rather than tipping its head forward and starting to suck instead. Often when you're establishing breastfeeding with a family, getting the baby on really well is the key thing, and we don't really think about how to maintain that latch later on, so that's an extra little nugget of information. When babies are a little bit older, sometimes they find that they get out of the habit of that really good wide open mouth and tip back head, and they get themselves into a sort of spiral of feeding with that very small mouth, and it can start to cause pain, it can start to cause damage, but even where there's no pain and damage, sometimes it means that the baby is just feeding less effectively, and so perhaps their weight gain, it stops rising so fast, perhaps they start having more digestive issues, or perhaps they actually start rejecting the breast a little bit, particularly if they're being bottle fed as well. So let's look at techniques for getting an older baby to adjust their latch into a wider open mouth, because the baby, having learned that it's really good way of feeding, doesn't really want to change, so we have to really nudge them. So the first thing to do is start with the baby at the breast wherever they want to feed. Get the baby on however they want to feed, And then, just like with a younger baby where we're trying to cement the latch, effectively, even though they've got quite a narrow mouth at this point, pressure through the wrist and back towards the baby's feet just means that the first thing the baby's doing is learning to feed with their head further tipped back. And that's the first step. The next step would be to gradually move that chin slightly further away from the base of the nipple, so that as the baby is feeding, the first time they go on to feed, they might have quite a shallow mouth, but gradually over time, the wider and wider mouth will come because the chin is placed further away and the baby has to reach further up to get on. Our maternity nurse training at Babyem covers all sorts of information about breastfeeding support and optimising the latch. So if you're looking for more information, better, newer information to help you to support those families, whether you are trying to upskill or whether you are slightly changing your career path to work with newer, younger babies and their families, then you can click on the link below for more information. So we've talked about what a good latch looks like, how to achieve it, why it's important, how to maintain a good latch, and then how to shift an older baby into a better latch. Thanks for watching. Carry on supporting those families. It's so important. Thank you for all you do.